Hi, my name is Nicole Hemingway, and I am the CEO of the U.S. Pain Foundation, a national nonprofit dedicated to improving the quality of life and health outcomes for people living with chronic pain. Migraine and headache disorders can be debilitating, and they go beyond just a simple headache. Today, let's delve deeper into understanding these conditions, exploring their prevalence, symptoms, and available treatments. According to CHAMP, the Coalition for Headache and Migraine Patients, in the United States alone, more than 42 million adult Americans have reported experiencing migraine or severe headache. It's more common in women than men, with 21% of women experiencing migraine or severe headache versus nearly 11% of men. A study published in 2020 in the Journal of Headache and Pain reported that migraine is the second most disabling disease in the world. Yet despite migraine's prevalence and debilitating impact on individuals' lives, research suggests that 40 to 50% of people who have this disease are still undiagnosed. There are over 150 types of headache disorders. Recognizing the symptoms is crucial for proper diagnosis and management. Today, we will discuss migraine, cluster headache, and new daily persistent headache. Migraine is a genetic neurological disease that exists on a spectrum. Each person's experience is different. Migraine often presents with intense throbbing pain, sensitivity to light and sound, nausea, and vomiting. Some people also experience aura, which can present in the form of a blind spot, tunnel vision, or seeing stars or zigzag lines. Dizziness, ringing in the ears, and difficulty speaking are also forms of aura. People living with migraine can be divided into two categories: episodic and chronic. People who are episodic have fewer than 15 attacks per month, and those who are chronic have 15 or more attacks per month. In the past 5 years, there have been significant medical advancements in migraine treatments, including new medical devices and classes of medications, such as CGRP, or calcitonin gene-related peptide. There are two main categories of migraine treatments: preventatives and abortives. Preventatives are taken daily to ward off a migraine attack before it starts. In many circumstances, an attack can still occur, but the aim of the medication is to reduce the frequency. Abortives, also known as rescue or acute medications, are taken when a new active migraine attack begins. It is important to take an abortive at the very first sign of an attack for it to be the most effective. Other treatment options include Botox injections, nerve blocks, nerve decompression surgery, nerve ablation, ketamine infusions, medical cannabis, external stimulators or medical devices, and surgically implanted stimulators called neurostimulators. Complementary therapies such as acupuncture, biofeedback, and acceptance and commitment therapy may also be beneficial for some individuals with migraine. Cluster headache is believed to stem from malfunctions in the hypothalamus that cause arterial swelling creating pressure on the trigeminal nerves in the face. Attacks last anywhere from 15 minutes to 3 hours and are characterized by excruciating, one-sided pain focused around the eye or temple. During an attack, one may feel the urge to rock back and forth or pace. It is often accompanied by autonomic symptoms, such as drooping eyelid, pupil constriction, tearing up, runny or congested nostrils, facial sweating, or facial flushing on the affected side. Attacks recur frequently over a period of weeks or months, hence the name cluster, and are then followed by periods of remission that may last months or even years. The treatments for cluster headache typically involve both acute relief during an attack and preventative measures to reduce the frequency and severity of future episodes. For acute relief, high-flow oxygen therapy is one of the most effective treatments, along with medications such as triptans. Medications like calcium channel blockers, lithium, anti-inflammatory drugs, and anticonvulsants may be prescribed to prevent or reduce the frequency and severity of cluster headache episodes. Nerve stimulation may also be prescribed. Non-invasive options include vagus nerve stimulation, while more invasive treatments include occipital nerve stimulation or deep brain stimulation. There is research now being conducted on the use of psychedelic drugs such as psilocybin and LSD for relieving cluster headache and their efficacy in treating cluster headache. For those living with cluster headache, it is important to understand that these types of headaches evolve, meaning what works to abort or prevent attacks for one episodic cycle may not work during the next. This is why it is essential for individuals to work alongside their healthcare team and have multiple treatments available in their toolkit to relieve their pain as quickly and reliably as possible. New daily persistent headache, or NDPH, is a persistent headache occurring daily from its onset. It is a primary headache disorder, meaning it is not caused by another condition or disorder. It is a rare type of headache that starts suddenly and becomes a daily occurrence present for 3 months or more. The pain lacks characteristic features, meaning it may be similar to migraine pain, or it may present more like a tension-type headache, feeling like a band or vice around the head. It may also have elements of both. NDPH can be challenging to treat, and the prognosis varies among individuals. Some people may experience partial or complete resolution of symptoms over time, while others may continue to have persistent headaches despite treatment efforts. Treatment for NDPH often involves a multidisciplinary approach. Medications like non-steroidal anti-inflammatory drugs, tricyclic antidepressants, anti-epileptic drugs, and muscle relaxants may be prescribed to alleviate pain and manage associated symptoms. Stress management techniques, relaxation exercises, regular sleep, and dietary adjustments may help reduce headache frequency and severity. Techniques such as massage, restorative yoga, physical therapy, and acupuncture may also provide relief for some individuals. And finally, counseling acceptance and commitment therapy, or biofeedback may be beneficial for individuals with NDPH, especially if stress or psychological factors contribute to their headaches. Consulting with a healthcare professional is extremely important for managing migraine and headache disorders. Start with a primary care physician or general practitioner. These healthcare providers can assess your symptoms, provide initial treatment, and refer you to specialists if needed, such as a neurologist, which is a doctor who specializes in disorders of the nervous system. Neurologists can conduct further evaluation, order diagnostic tests if necessary, and provide specialized treatment plans. Another medical professional who specializes in the diagnosis and treatment of migraine and headache disorders is a headache specialist. These specialists have advanced training and expertise in the management of various types of headache disorders. They are well equipped to perform thorough evaluations to identify the underlying cause of your pain and can diagnose your condition and develop a treatment plan tailored to your specific needs. Other providers who treat migraine and headache disorders include pain management specialists, ophthalmologists, otolaryngologists, nurse practitioners, and physician assistants. Additionally, complementary and alternative medicine practitioners, such as acupuncturists and naturopathic doctors, may offer different approaches to managing headache diseases. But do your research to make sure that the science supports the treatment option or options that you choose. Living with migraine and headache disorders can be challenging. But remember, you are not alone. Seeking support from peer support groups and online communities is crucial if you are living with this condition. These networks not only provide access to a supportive community, but also offer comfort and a sense of belonging. The U.S. Pain Foundation offers free online peer support groups through its program, Pain Connection. Education also plays a pivotal role in helping you take control of your migraine and headache journey. By connecting with patient advocacy groups or nonprofit organizations, you can learn more about how to manage your disease, raise awareness about migraine and headache disorders, dispel misconceptions, and foster understanding among the general public. As we wrap up, remember that knowledge is a powerful tool in managing migraine and headache disorders. Seek proper care and work closely with your healthcare team to develop a personalized treatment plan. Timely diagnosis and effective treatment can improve health outcomes and overall quality of life. Through increased understanding of the complexities of migraine and headache disorders, we pave the way for improved diagnosis, treatment, and support for those affected. Thank you for joining us, and until next time, remain informed, stay empowered, and take care.